was actually thanks to Marvin Adelman that I even got the spot here. I came to Cornell as a biology major, and then one day I got to Kennedy Hall early for a bio class, came upstairs, randomly discovered the Department of Landscape Architecture. I met Marvin, and I told him that I was thinking of going to medical school, and I was interested in designing airports. Do you think I should take a class here? And he looked at me with a lot of skepticism, but at the same time was really supportive, and I didn't really realize it at the time, but I was really lucky that he introduced me to landscape architecture and welcomed me to the department, and it completely changed the way I looked at the world. So just wanted to thank Mark before I got started. And so what I'm going to talk to you about today is first, trends in the American healthcare system, just a broad overview of some highlights of some of the issues in our healthcare system, some of the signs pointing to where we need to go. And then part two, I'm going to talk about what landscape architecture really brings to healthcare. Then I'm going to share some of my own journeys, some of the insights from my own experiences and how those fit in. And finally talk about where this is all going and how, if any of you are interested, how you can get more involved with healthcare. So the first, trends in the American healthcare system. Healthcare today, I don't know if any of you have had experiences visiting the hospital, clinics, either for yourselves or someone you've known. There are a lot of things that work, but there's also a lot of issues. The environments we spend time in are often not designed to be restorative or healing. There are these rooms without natural light. The layout of the room has a doctor sitting facing a computer, not really able to face a patient. And so there's a lot of challenges in the physical environment of the healthcare system today, and that's a lot of where people feel the healthcare system very tangibly. Kind of at the zooming all the way broadly to our healthcare system as a whole, you might have heard many statistics about how we spend the most money in healthcare compared to any other country. This graph is from a few years ago, but we are now spending close to 20% of our GDP on healthcare, which is much higher than most other countries. And the graph on the other side shows that for all that we're spending, we're not actually doing that great from any of the big measurable health outcomes in terms of life expectancy, in terms of access to care, and many other factors. And part of that many have come to realize is maybe we're not spending our money in the places that actually affect our health. This is a graph from a few years ago by a healthcare design agency called the Social Determinants of Health. That was based on a number of different research papers that were done that was trying to look at what are the factors that actually affect your health. In the yellow are your genetics, your biology, whereas in the blue, orange, green, that's really much more of your lifestyle, your environment. And this is from a few years ago, but it's really gets at this idea that our health is not really determined so much by our healthcare system, but by all these other things, by the world we live in, the things that we do on a daily basis. And the other issue too is that our healthcare spending is really disproportionate, has a lot of inequity. This is a project from Virginia Commonwealth University looking at healthcare disparities by zip code. And there's been a lot of geographic mapping of health disparities, and I think that's one area where planners, landscape architects, anyone working in healthcare geography has become more involved. And this shows within a 5-mile walk of downtown Philadelphia, you can have as much of a 20-year life expectancy difference from 88 years to 68 years, depending on where you live. And this is the same information presented in more graphic illustration, and I just wanted to bring this up because there's more and more artists, graphic illustrators that are getting into healthcare data just to make things, to bring more visual clarity to a lot of numbers that are often complex and confusing. And the other issue that we're also learning is that many of the factors which affect our health have to do with poverty, Depending on your household income, that has a lot to say about your likelihood of developing different chronic disease. And we're also learning that this adversity and inequality in healthcare starts really, really early. And we're learning much more about the effects of healthcare across the lifespan. And this is part of the reason, one of the reasons why I chose to go into pediatrics. We're learning that adversity that children face in childhood is related to health outcomes across the lifespan. And one of the most important studies showing that is this paper from 1998 called the ACEs study, or Adverse Childhood Experiences study, where they looked at 10 very extreme things that could happen to children, whether it was death or separation of parents, being abused as a child, and facing other kinds of trauma, neglect. And what they found was, since that original study, there's been a lot of science around how that trauma affects the developing brains as well as the immune systems of children, and if that is not addressed, it starts to lead to underlying physical health changes. And so they found, depending on the number of ACEs you have, if you have 4 or more ACEs from their scoring system, you have a 3 times greater risk of heart disease or lung cancer, and it leads to major differences in life expectancy. And so we're learning that things that actually affect our health are much broader than the healthcare system. They're much more at the scale of society. And even broader, the global scale is climate change, which I'm sure talk a lot about sustainability in all of our design, and landscape architects are really at the forefront of bringing design into the conversation of climate change. And what's now also starting to happen is many healthcare professionals are really getting into discussing climate change because we're understanding the environmental health impacts have direct human health impacts. And there's a number of different forces at play depending on weather-related changes and how that may affect certain healthcare outcomes. The changes in temperature is changing flu seasons, and of course the people who are most affected by climate change are also those who face the most, those that face the most inequality are also the ones that are most susceptible to the changes brought by climate change. So there's a lot going on in healthcare where the healthcare system realizes that things are not working. The things that actually affect health are way broader, at a more global, at a community scale, really outside the walls of the hospitals. And so many in healthcare are asking, how might we do things differently? And we're at this time of great change in healthcare, from how we pay for things, the regulation, and just what does our healthcare system mean for us. And so at this time of great change, there aren't a lot of clear answers of how we move forward. And I think this is where landscape architecture is uniquely well suited to help provide some answers, some ways to go forward. And I think it's both the type of thinking that is developed as a landscape architect, as well as a lot of the practical skills that are forged. And so what does landscape architecture actually bring to healthcare? This is something in my reflection of what landscape architecture is and what it brings. I think landscape architecture is long-term, ecological, multi-scalar, systems-based design thinking with strong roots in public health. We think of projects often on very long-term scales. You might design a park and you have a vision for what the trees are going to look like, but it's going to take decades for it to actually appear the way that your initial rendering showed. And being able to be okay with that, and being able to be okay with your designs changing with biological forces that are often not under our control, I think is a really unique type of design, a type of design that's adaptable and resilient. And I think that's the type of design that's needed for healthcare. There's a lot of changing forces, and we don't really know where things are going to be. It's multi-scalar, the ability to design a large park and focus on the small details as well as at the large size as well. And it's all been really rooted in public health. often starting with Frederick Law Olmsted. I'm sure all of you know Frederick Law Olmsted is the father of landscape architecture, the designer of Central Park. And I'm not sure if all of you are aware, a lot of his early roots actually started in healthcare. During the Civil War, he worked as a sanitation commissioner and was really influential early on in starting to understand the role of urban design and disease control. At this time, the germ theory of disease was still not fully developed, but it was happening around this time, and Olmsted was keenly aware of how the design of environments affected the type of pests that might come by, how the design of certain spaces affected people's mental health. And so in his early days, before he became a landscape architect and really created the field, it was really rooted in a lot of concepts of public health. And yeah, this was getting the same thing. And so to highlight more specifically some of the specific examples, I mentioned this idea of multi-scalar design. You're designing something like Central Park, or any of the projects that you're doing, you're designing often at these large scales where you're looking at these aerial views, and you're thinking about how traffic might flow across kind of at the scale of a city planner. But then at the same time, you're going down to these very intricate details, understanding design at the human scale, and being able to translate across both from that human scale to that very large urban scale or even global scale, and thinking about design continuously across all of those is, I think, a unique skill set in, especially in landscape architecture, and I think is really important for how we think about the design of healthcare. We learn a lot about participatory community-based design, about community-based planning, and this is an example of a project a pediatrician friend of mine started in Rochester as well as in East Harlem called Cyclopedia, where physicians and planners would work with local youth groups like the Boys and Girls Clubs to create opportunities for cycling throughout the city, but also to understand and explore their cities. There's a deep knowledge of nature, of really knowing every aspect of plants, of learning about the different therapeutic effects and benefits. That many of you might know the Therapeutic Landscapes Network. It was an organization, a platform created by Naomi Sachs, who is now currently at Cornell, and recently connected with her and talked about how landscape architects and healthcare professionals can collaborate more on this. And the American Society of Landscape Architecture also has a great number of resources on their website about different articles and studies that have shown different healing benefits of nature. But a lot of this is still kind of rudimentary, and there's still, I think, a lot more that is coming up. Some of the other skills that we learn are how to spatially and geographically reason, represent things. Just as a very practical example, learning how to read topography and maps was really helpful from when I went to medical school and had to learn how to read x-rays, other anatomical images, where you have to really have spatial and topographical reasoning. So it's just a very practical example of something that I learned here that I was then able to apply in medical school. So those are just some of the broad ideas and concepts of things that I put together in discussions with others about the types of thinking that landscape architecture forges that might be really useful in healthcare. So next, I just wanted to share my own journey in case it might be helpful for any of you, provide any interesting insights. And throughout this, I'm going to basically share different aspects of intersections with landscape architecture. So I grew up in Utica, New York, not too far away from here. Came over to Ithaca and then was in med school in Syracuse, and actually was Syracuse and partly in Binghamton as well. So I really spent a good part of my life in central upstate New York, and that's where I think a lot of my early thinking was formed, and early experiences with landscapes were really around this area. But this was really my first examples, my first experiences with landscape architecture, really through video games. As a child, I didn't particularly enjoy going outdoors that much. So in many respects, I am a accidental landscape architect, I think. But I think, you know, I remember playing a lot of video games that really emphasized different landscapes, and I don't know if any of you, I'm sure you remember Sonic the Hedgehog was really actually about machine versus nature, and so I think there was always something in there that was very related. And now we're getting to more modern games like Zelda, Breath of the Wild, where landscapes are incredibly immersive, expansive, and my understanding too is that landscape architects are getting more and more involved in video game design. And so that was super cool for me to hear, because that's where my early experiences with landscape started. And then when I got to Cornell, I was, initially I started off as a biology major. That was a salamander we had to dissect. And then also became a landscape architect major. And so ended up doing both. And that was the wonderful thing about Cal's, to be able to have such interdisciplinary options of study. And throughout a lot of my early studio projects I was taking things that I was learning from biology and bringing them over to landscape architecture. So this is one of our early studio projects where we have to understand this space in downtown Syracuse, Hanover Square, and I was mapping it out to different biological body systems and understanding the functions of the different spaces. And then the other project was a project in Austria where it was actually bringing, you can't really tell from this picture, but it was about bringing coral reefs into this. It was using the design of coral reefs and bringing that into this museum space. And so a lot of my design was inspired by different biological things that I was learning about from biology, bringing it over to landscape architecture. And at the same time too, I was also becoming increasingly aware of environmental health. It was something that training here really taught me with all of our discussion about sustainability. It was something that before I came here did not realize it as much. And this is one of the projects we did in our studio, our third year. We had to redesign Liberty Park, which is right across from the World Trade Center. And part of what I wanted to highlight here was what I remember from September 11th was even with the entire tragedy that happened, it was this amazing time when everyone in the city, in the state, in the country really came together in the show of resiliency. And so part of my design of Liberty Park was actually capturing that coming together of the city against some of our biggest threats and challenges. And so it was designed, I think that the biggest threat that's facing New York is climate change. And so part of this park was actually around, there's this water tower that changed based on the number of people that walked through the area. That was actually, it was based on stormwater that was running off. And it was this whole interactive exhibit that you can't completely tell from this picture, but it was to help people from their day-to-day actions understand what was going on with climate change and to connect with that at a broader scale. And at the same time, and with this project and others, I was also becoming more aware of the importance of technology, of data, of being able to do interactive pieces like this. It really requires not just the built environment and landscape, but this merging of the infrastructure with technology, with sensors, with all of these devices that we now carry in our pockets, and being able to take the data from that and bring that into the landscape or into other design in creative ways. And so I had the opportunity to work at the Human Computer Interaction Lab, which is actually a it's between the departments of information science and computer science. I think some of the faculty for it are actually in Kennedy Hall as well. And so I went over and worked with them for 2 summers, helping them do user interface design, and we made this app for the Johnson Art Museum where people could view artwork there and tag different items with interesting tags and then use that to browse. And we ended up doing this project on how your virtual navigation on your phone affects your physical navigation in the museum and vice versa. And so this was one of my first forays into technology, into this intersection between technology and design. And this was like around the time of the second iPhone, so it's much older looking. And then another thing that was sort of related to all this was my honors thesis I did here was about, it was called Anthroportscapes. It was about airports as forums to discuss sustainability. And the idea is that as climate change is becoming more and more of a concern, one of the places that really exacerbates that or can really relate to that is air travel. And airports are this perfect place where people are often bored, are trapped, not really thinking about exciting things. And at the same time, we see this flourishing of artwork, of culture in airports. And as part of my thesis was actually being able to bring the local to the global and make airports forums to discuss sustainability, to actually make them museums about climate change that reacted to the local context and create engaging exhibitions for people to interact with while they're waiting for a flight. And so that was a little bit of what I did at Cornell, and it's kind of all over the place, as you can see, but it was also largely informed by the type of thinking and skills that were forged here. Then in medical school, I went to, not too far away, to medical school in Syracuse at SUNY Upstate. And one of the really fortunate opportunities I had was to meet this guy named Dr. Richard Jackson, who is a pediatrician that has actually been working on these issues of urban design and public health since the 1980s. And he had this PBS documentary series called Designing Healthy Communities, and Syracuse is one of the cities they featured. And we actually walked around the city. We're looking at things like the quality of sidewalks and how that impacts walkability, and how that has a lot to say about whether people can exercise or not, and how that needs to be looked into the overall consideration of our healthcare system. And then I also worked with Syracuse University School of Visual and Performing Arts, and we set up a design charrette around healthcare communication with some of their design students and medical students, and also some of the landscape architecture students from SUNY ESF. So I was mostly focused on medical school, but at the same time I was trying to take the things that I was learning here and bring them in over there. And then I also had the opportunity to work at the Mount Sinai Pediatric Environmental Health Specialties Unit. So the EPA, the Environmental Protection Agency, has these centers for pediatric environmental health. Many parents are concerned about the chemicals their children get exposed to, concerned about different air pollution for children. And so these centers, they're split across the country at along the EPA zones. And they're places where pediatricians, environmental health specialists work together to research, to bring together the latest research around environmental toxins, environmental health, and children's health. And so I had the opportunity to spend some time there. And when I was there in 2010, it was actually when Tide Pods first came onto the scene. And I know that the Tide Pod Challenge has been a recent phenomenon. But back in 2010, when the Tide Pods first came out, a lot of young children were accidentally ingesting them. And so I actually got to go on a press briefing with Senator Schumer about it. I didn't say anything, but it was just, it was a cool experience in advocating for children's health. And so what's happened recently is New York State is actually the very first state to have something called the New York State Children's Environmental Health Centers all across the state. So we are in the Rochester area where the different children's hospitals across the state are establishing these centers of expertise around all things environmental health. And so they're just getting started. And one of the things that they're doing that they've talked to me about is with all the technology in healthcare, being able to better integrate environmental health into some more of the technological infrastructure of our healthcare system. So I can tell you more about that if you're interested. And then these are two of the hospitals where I train. So in New Jersey, Rutgers, Robert Wood Johnson Children's Hospital, and so there's a nice garden there. And the new Stanford Children's Hospital has this entire outdoor garden. And for a lot of the patients' rooms, they can face out to the garden, go out there, not just patients, but the staff working in the hospital. And so, there's been a lot of literature over the years about the importance of making hospitals actually be healing environments. And so it was nice to actually be able to work at places that have that, but not every hospital has access to such amenities, but it was nice to be able to be at a place that did. And then while I was in New Jersey, in my pediatrics training, one of the projects I worked on was called Drawing Play. And pediatricians, I don't know if you all think back to visiting your pediatrician as a kid. You go to your pediatrician every year, and pediatricians are interested in helping children be active, to play. And usually what would happen is pediatricians would ask either a child or a parent, hey, what do you like to do for fun? And most kids don't like talking to the doctor. And so one of the ideas and insights I had was to try to shift the language and the medium. Children don't often communicate well with verbal communication, and drawing is a really powerful means of communication for children. And so we did this project where while children were sitting in the waiting room, we asked them to draw where they like to play. And then when they came in to see the doctor, we would ask them about their drawing. And it did two things. It gave us much more insight into what they thought was important. And it set the visit at the level of the child. This wasn't just a visit where a doctor and a parent would talk, and then as a kid you just get shots. But this was really about saying that this was about you as a child. And this was one drawing wanted to share, because I never thought, if I hadn't seen this drawing, I wouldn't have known that going to church was one of the important places of play for this child. And so I think being able to have children draw can open up really interesting insights into how they think about the world. And this was actually a research study that was done, and I'm still analyzing some of the data from it, and hopefully hope to publish it, but just wanted to share some of the data from it, from the drawings that children did. There's 26 drawings, and these are some of the places that they drew. So parks and playgrounds, backyards were the most popular. And we had surveyed the other pediatric residents about this, about what they thought. And most people thought this was an important project to do, but this is one of the frustrations of many doctors. We can talk about the importance of having a place to play, but if there's nowhere for that child to play, or if parents don't feel safe taking them there, then for doctors it's often frustrating talking about it, because it feels like there's nothing we can do about it. And that's where I think we need to close the loop better, because for landscape architects, for city planners, that are the people who are actually working to design the built environment that affects the way people use it, you often don't have enough data from what people think about these environments. And so one of the long-term goals and visions of this that I've had is, how do we take those insights and conversations from those visits, from those healthcare visits, if we know that, okay, all the children in this particular neighborhood really want to play soccer and there's no soccer field, how do we take that insight and bring that up to the planners, the policymakers, in a way that respects patient privacy, but also helps give a voice to the children, to other patients, and provide, I think, an alternate channel for community-based participatory design. And kind of with that too, this is just kind of a conceptual sketch of how that can work with the electronic medical record. Now more and more, ever since 2014, most hospitals and doctors' offices use electronic medical records that have patient addresses, but don't often have geographic information. And this is something that a few people are working on building and actually bringing up. If I recommend to a parent that their child should ride a bike, I should know, I should be aware if they live right next to a highway where there's a really high number of bicycle accidents. It would be, bad to say that. And so oftentimes doctors and other healthcare professionals are giving advice without any geographic context whatsoever. And I think we have a huge opportunity with the electronic health record to bring in geographic information into healthcare conversations. And I wanted to highlight this platform called Streetwise. Streetwise is a platform developed by a team at UCSF in Oakland that goes beyond the reviews that you get on Google Maps. It's not just about seeing that there's a grocery store in a particular neighborhood, but it's actually getting the local knowledge that, oh, this grocery store never has fresh fruit. So it's a platform to enable local citizens to share knowledge on a map that's more contextual and relevant. And then when I got to Stanford, so you could see I was getting interested in how to integrate all of these conversations with technology to bring geographic information in, to be able to connect the conversation of a doctor with city planners. Technology is really the medium that enables this. And so there's this new field of medicine called clinical informatics, and it's actually a new subspecialty of medicine, just like cardiology is. And the idea is that information and access to information is really important to care delivery. And so Stanford started the very first training program for this in 2013, and now there's fellowships for doctors around this all around the country. And so that's where I was. That's what brought me out west. I moved out to California in 2016, and wanted to just highlight two different things that I did. One of the projects I worked a lot on was this thing called Open Notes, and I don't want to get into the specifics of it, but the broad idea is that the healthcare system has a lot of information about patients, and you as a patient often don't have access to that information. It's hard to get. You have to call a bunch of phone numbers, go through a lot of faxes before you can get access to any of that. And what's happening now is there's this whole cultural shift saying that individual patients should have the ability to log on and see all the information that your doctor is saying about you, so you can see your lab results, so you can see other information. And I think that part of that culture change in medicine is really important to consider, because it's opening up all sorts of new possibilities where we can have two-way digital communication around some of the interventions I talked about, like children talking about where they like to play. And then on the right side, this was a paper I wrote. It was just a short paper in the American Planning Association newsletter with one of their chairs of technology about this idea of how planners and healthcare professionals need to connect together with data to be able to make better decisions about designing environments that affect your health. And that brings me to what I do now. So starting last year, I finished this fellowship at Stanford, and I work mainly at this company called DocAI. It's a technology, it's a healthcare startup, and what it does, it's a platform for individuals to connect healthcare information from different places. And then we use bring AI, machine learning, new computational technology to try to help make sense of all these data points. And one of the big things we're really focused on is environmental exposures. And the term that's coined is the exposome. So there's like your genome and then the exposome. The exposome is all the environmental factors that affect your health. It could be air pollution, could be pollen, could be temperature. And so this is a platform to help connect these bigger dots together. And then I also work part-time as a pediatrician in Stanford, And one of the initiatives that I've become more involved with recently is the park prescription program. There's a number of pediatricians that have been collaborating with the National Park Service, with local park services, to bring together park prescription at pediatric and adult visits for both mental health issues, for physical health issues. And at UCSF Oakland, there's this place called the Center for Nature and Health. They're actually funded by REI, and they have really been looking into studying how effective these interventions are. But from the early experience and early research, it's pretty effective. And so that's a bit of my journey. Wanted to just show you what I've done over the past 10 years since graduating from Cornell, and show some examples of where landscape architecture fits into the broader healthcare system. And then finally wanted to just end with where we're going next, and just share a few different thoughts and ideas to just hopefully spark some ideas. We're seeing more and more designers, not just landscape architects, get into healthcare. There's a lot of information designers, product designers, there are architects getting into healthcare. And one of the areas that has caught a lot of attention is the design of a lot of the forms, the instructions for medications, the instructions for your lab tests or what you're supposed to do for your bill. So this is one area more of graphic design that I think some people are always interested in. That is an area that's exploding, graphic design in healthcare. There are more and more articles coming out about urban design and mental health. This is a great article in City Lab about the design of Tokyo. Tokyo, even though it's twice the population of New York City, has there's a lot been written about it, about how even though it's this large metropolis, there's a lot of thought that's gone into spaces for mental health, with attention to green space. And this was actually an article that was also featured in there's this new journal called Urban Design and Mental Health. That's super cool. You're seeing landscape architects collaborate with architects for hospital design. There is, in England, in the United Kingdom, there's this really great organization called Maggie Centers, and these are buildings for cancer support that are they're not hospitals or clinics, they're basically places where anyone who's been diagnosed with cancer, or as a family member who's been diagnosed with cancer, can just go there, can meet other people who are going through similar circumstances, can get some medical information if they want to, but they're really these spaces for contemplation, and they're all over the United Kingdom. And they partner with some of the top architects and landscape architects around the world to design these spaces for healing. And then over on the right side, this is actually in a hospital in Norway, where I forget if it's a hospital or like a rehabilitation space. They have started to build these tree houses for patients to spend some time in during their hospital stay. So there's a lot of work going on in this space of bringing nature into the architectural experience of healthcare. There are a lot of different projects working with children in playgrounds. This is an example also from the UK of working with children and helping them imagine what they would like to see, similar to some of the work that I shared earlier. You're starting to see a lot more articles in the New York Times recently about the benefits of spending time in nature. And these articles, if you delve into them, they're built on a number of different studies that have been done. So far, a lot of the studies that are cited are 10 or 20 years old. There's a really famous study from the 1970s called A Room with a View, showing that after abdominal surgery, after you had an appendix removed, if there's a hospital, I forgot exactly where it was, but they had one wing of the hospital, patients were looking out to a parking lot. One side of the hospital, patients were looking out to trees. And the patients looking out to the trees had a shorter length of stay, used less pain medication, and their nurses reported them as being overall more satisfied with their care. It was a small sample size of, I think, about like 50 patients, and it was an older study. But what we're seeing now with the convergence of technology, especially with our smartphones, with having the sensor that goes anywhere with us, we're actually now able to do much more larger scale studies of the benefits of nature and health that we were really never able to do before. So we're starting to get many more interesting studies around this. Yeah, this was another one in that same vein. That was more recently about looking at children's performance on testing after spending time outdoors. We're also seeing a lot more population-based studies. A lot of these come out of the United Kingdom because they have a national health service. They have a centralized database where they can do easy, they can search across the population. And so there's a lot more evidence for health benefits from designing walkable neighborhoods, whether it's for hypertension prevention, prevention of Alzheimer's, or helping people with Alzheimer's or other types of dementia understand where they are. And furthermore, we're actually starting to see more rigorous economic analyses. This was a really interesting paper about the cost effectiveness of bicycle lanes in New York City. And just to give you the number, the way they did this was they looked at a number of different factors. If you actually have a protected bike lane, you're much less likely to have a bicycle accident. So then the person on the bike wouldn't need to go to the emergency department and wouldn't have all the costs of that. If this person on the bike was killed, there are a lot of, it's a terrible tragedy, and then there are also a lot of healthcare costs that are associated with that. And so what they did was looked at all of these different factors and tried to estimate for building bike lanes, how much is it actually saving the healthcare system. And they use this measure called quality adjusted life years. It's one of the measures that healthcare economists like to use to look at the cost effectiveness of different interventions. And so, building bike lanes, they estimate it's about $1,300 benefit for quality adjusted life years. And if you know anything about healthcare economics, this is one of the most cost effective interventions in all of healthcare. And so I think we're starting to see more studies like this that add a lot of health rigor and financial rigor that are really putting a lot more teeth behind the interventions that we've often talked about. We know that having protected bike lanes are good, but now we're starting to know exactly how good and how effective they are. And those numbers, I think, they're not important necessarily to convince the public that they're good, but they help add a lot of teeth to policymakers that are trying to shift where we spend our money in healthcare. And part of this is connecting healthcare professionals. It's building these connections from planning to healthcare. And Seattle Children's Hospital a few years ago was deciding on they needed to build new parking garages because their hospital was growing, they had more employees. But someone in Seattle Children's Hospital was really insightful and realized that many people could actually bike to work. And at the very same time, the Department of Transportation in Seattle was thinking about ways to expand bicycle infrastructure in Seattle, but they didn't have the funding for it. And somehow there was this cross-sectional connection where the Children's Hospital actually became the major funder and financial driver for bicycle lanes in Seattle. And it actually led to a bicycle repair shop being built at the Children's Hospital. 20% of people who worked at the hospital were able to commute to work by bike, and they didn't have to build this parking garage. And so part of this was building that alignment across sectors that haven't necessarily worked together recently. And almost at the end here, this was another similar example in Cincinnati. This project on the left side, this was a mapping project where Cincinnati hospitals were looking at patients coming in with asthma, and they started to look at a lot of the geographic factors, exposure to air pollution, and different geographic factors that affected whether or not children would have an asthma attack. And so there's on the right side, this is an organization that is working to bridge the worlds of hospitals and real estate and a little bit of planning. And so there's more and more organizations that are coming out that are helping to bridge this divide. And so just almost at the end, I just wanted to close with sharing a few broader thoughts. So in healthcare, we are now shifting upstream. We're thinking of health as not just as what happens in the hospital, but what happens in your day-to-day life, in the environments that we live in. And it's not just nice thinking, but it's actually regulatory change, it's financial change. We're spending money in different ways. So that is a big difference now compared to even 10 years ago. We are also in healthcare really looking at systems design and really understanding how all of the different pieces integrate and intersect with each other. And that has opened up a whole new way of thinking about our healthcare system. And we are also thinking a lot more about equity. This is from the Martin Luther King Jr. Memorial in San Francisco. It's one of my favorite parks. It's a really simple park. It's just this water feature, and then when you go behind the waterfall, there's different quotes from Martin Luther King Jr. And it's a really simple but powerful park, and one of my favorites. I wanted to share that. And so going forward, one of the ideas that I've had is to try to bring back the vision of Frederick Law Olmsted when even before he was known for landscape architecture. A lot of his early vision was rooted in public health. And in 2022, it's the bicentennial, or 200 years of Frederick Law Olmsted from his birth. And part of what I'm trying to do and really interested in doing is helping to expand this conversation from the healthcare world to landscape architects and everyone in between about how we can actually work together to design a healthier environment. And this was just I started a Facebook group called Olmsted Health, and there's just a few people on it. There's other landscape architects who graduated from here who've gone on into healthcare. Nicole Deaster, who's a student here, went into nursing. Rachel Hendricks went into social work. There's another landscape architecture student who graduated recently, George Anderson, who's planning to go into medicine. And so there's a number of connections between landscape architecture and healthcare. And this is just one of my ideas of maybe how to start to bring this conversation together. And so with that, I wanted to thank everybody for listening. That's my Twitter account and my email. And then just wanted to thank a lot of the faculty here. Wanted to thank, I don't know, there's a lot of faculty who aren't here anymore. Marvin, Peter, Amici, Kathy, Dan, Paula, Jamie, Lenny, and many others. And so just, yeah, thank you. Thanks for your time.